I became interested in medicine when I was 8 years old because of my pediatrician. I felt a close relationship to that pediatrician and decided actually at the age of 8 that I wanted to be a pediatrician. The friendliness and the atmosphere in his office and how he related to me as a child. I was born in New Orleans, lived in New Orleans most of my life, and that's where I grew up. Was educated in the parochial school system there. Went to Jesuit High School in New Orleans, Loyola University for undergraduate work, and Louisiana State University School of Medicine. Spent most of my life in New Orleans, actually, until about 1992, except for a short stint in the military. When I finished my internship, I went into the Navy, and I was a general medical officer in the Navy for 3 years. I went to Vietnam with the 4th Marine Division as a battalion surgeon, came back to New Orleans and finished my last year of service as the Chief Medical Officer for the 8th Naval District. I then served 6 months in the south of Vietnam in a little town called Bao Xuyen, where I worked with a Vietnamese hospital program under the auspices of the State Department. I saw an awful lot of medical cases. I saw a lot of trauma, and I liked the medicine that I was doing there, but I was glad to leave a war zone. When I first started medical school, I did want to be a pediatrician. That was my goal. I went through several times of changing my mind. There was one point where I wanted to be a psychiatrist, interestingly enough. Another time I wanted to be a radiologist, but I settled back on pediatrics after I left the Navy. I went back into pediatrics. But most of my medical school training and the job that I had in the Navy really was more general medicine, so I consider myself very well versed in not only pediatrics, of which I'm board certified, but also I feel very, very comfortable with family medicine. Over 25 years in emergency medicine as well. When I was practicing in California with a very large Kaiser Permanente group, we had 150 physicians in our group, very large clinic. And there I was doing mostly pediatrics. In 1992, I received a call from a recruiter who was opening or trying to establish a pediatric emergency room in Lubbock, Texas. The idea appealed to me, and I joined that group and started doing pediatric emergency medicine. Over the years of doing that, I also worked in general emergency rooms, specifically Corpus Christi, Texas, another general emergency room in Lubbock. And basically, I feel very comfortable doing emergency medicine as well as pediatric emergency medicine. Most of my current medical education is done in several different ways. I belong to a online program called Up to Date, which is actually a very fantastic program. I can pull up recent articles on almost any subject in medicine that I choose to do. Also attend multiple conferences over the years, very essential to continue to practice emergency medicine. It's extremely difficult to keep abreast of all the knowledge that comes out on a yearly basis, and to sift out the important things to know and those that are not important to know. The interesting thing about doing a family practice, pediatric practice, is that there is a great deal for you to know. And on a daily basis, it's good to have access to knowledgeable databases that you can pull up information on various and sundry patients. But it's not an easy task. It's something that you really almost have to do on a daily basis, really. I lived in Cartagena, Colombia from the age of 10 to 12. And of course, Spanish was very easy to pick up in those times. When I came back to the United States with my family, the Spanish was not something that was continued, so obviously I lost some of it. But the ability to have the accent and to learn the language very quickly still stays with me. I worked in the Rio Grande Valley in Edinburgh and McAllen, Texas for a year and a half, running an emergency room down there, children's emergency room, and of course Spanish, 50% of my patients didn't speak any English at all. So I'm fairly comfortable with medical Spanish and actually most other things. I do have a Latin background, so knowing the Latin language has helped me a great deal with Spanish. Diabetes is a very complex disease, as you well know, and many people in this area of the country have a real problem with diabetes. It's very prevalent in the Hispanic population. We don't actually take care of diabetes in an urgent care. This is an urgent care facility. We do diagnose diabetes. We do take care of the patient if there's a problem when they come in. But as far as the actual day-to-day management of the diabetes, that is usually done by a diabetologist or their primary care physician. This facility is North Central Urgent Care. It is one of the premier urgent care facilities in the area. It was opened 10 years ago. We have a very large client base who have come to know us and appreciate the work that we do. Our role really in the medical care of the patient in this community is one of obviously urgent care, which could be anything. It could be a sore throat, it could be a broken bone, it could be a laceration. And we function pretty much as a minor emergency care facility. And we actually save the patient a great deal of time and resources if they do not have to go to an emergency room. One of the more interesting cases that I had in the urgent care, a woman of about age 45 came in and she had had some blood in her urine for 2 days previously, but was in no pain, didn't have any history of urinary tract infections, and the blood was gone. So she was concerned that she had had some blood in her urine. We did a urinalysis here, and she did indeed still have some microscopic blood in her urine. I just didn't really feel right about that. And so I felt that we should further pursue this, even though the symptomatology was essentially gone. She didn't have any more pain. She actually never had any pain. And it ended up, to make a long story short, we did an ultrasound and a CAT scan, and she ended up having a cancer on her kidney. And I was very gratified with the fact that we were able to completely salvage her without any chemotherapy whatsoever. The urologist was able to remove that kidney, and she's perfectly cured of her problem. And it just made me realize that sometimes you do have to pursue things even though you may think there's nothing there. I had a child at the age of 4 who came in with his mother. The child had been running fever for approximately a week, relatively high fever, with not much of a cough, but a slight cough. When I saw this child, it became immediately observable to me that the child probably had a pneumonia. Took the x-ray, and the entire right lung was completely consolidated. Got the child to the hospital immediately, immediately up to ICU, and basically we were able to save this child's life, because another day may have been fatal for this child. Those two cases illustrate the fact to me of how much satisfaction I get with the practice of medicine, that I was able to help these people in a very, very significant way in their life. The duty of the physician, first and foremost, is to do no harm. And by that we mean do not do things that are unnecessary, or to refer patients unnecessarily, or to provide treatments that are not good treatments. Secondly, in this facility, we have a duty and an obligation to our patients not only to treat their initial complaint, but if necessary to refer those patients to the appropriate facility or to the appropriate specialist. While we don't practice as a primary care physician, in many cases we do become the patient's primary care physician on a temporary basis. On a personal basis, I'm very conscious of the cost of medical care. And I'm very conscious of the fact that people have an obligation to seek the most reasonable costs for their treatment. We always, in this facility, write generic prescriptions. All of our prescriptions are generic. We have no problem, and I personally have no problem with changing a prescription to an alternative if the patient finds that the cost is too great. And we pride ourselves on that basis. It gives me great joy and satisfaction to know that I've made a significant difference in someone's life. Patients respond to that in a joyful way. I enjoy seeing those patients again, knowing that I've made a significant contribution to the well-being of their life. Many times I'm asked, why don't I retire? And my answer is always, I really, really like what I do. And that's a fact. Okay.